Scaling and root planing can be a really challenging set of words to hear for some patients. People come in, sometimes new patients come in to get their teeth cleaned, and before they know it, someone is poking their gums, spouting off a series of numbers, 3, 4, 5, and then the hygienist sits them up and says, "I'm sorry, we can't finish your cleaning. You need scaling and root planing." And we get a lot of questions about what this is and why. So let's talk a little bit about what scaling and root planing is and why we do it, and hopefully answer some questions so that if this comes about for you, you understand kind of what's going on in real time. Scaling and root planing is a procedure that we do that involves scratching or scraping the sides of the teeth and also the root surfaces of the tooth in order to dislodge bacteria that have settled underneath the gum tissue. So almost all cleaning appointments involve some degree of scaling. That is, the little metal hooks that we all love, our hygienist grabs and scratches at our teeth to dislodge calculus, which is solidified plaque on the teeth. All cleanings involve some degree of scaling. Almost all of that scaling happens above the gum tissue or supragingival, which means that the dentist is literally scratching the crowns of your teeth. Those are the top areas that we see and feel in the mouth. Every tooth has something called a gingival sulcus around it, and that's fancy terminology for a small pocket where the gingiva wraps around the tooth and kind of holds the tooth in place. And in a healthy mouth, this pocket can be anywhere from 1 to 3 millimeters deep. And that amount of depth allows proper emergence of the tooth from the gum tissue and also allows you to adequately clean those areas. Normal brushing and flossing is capable of cleaning pockets 1, 2, or 3 millimeters deep. Now, the challenge for patients, particularly as we get older, is we tend to see small amounts of gingival recession and or pocketing that forms around teeth. And what happens is that sulcus or collar of gum tissue around the tooth can loosen slightly and deepen slightly. And as that pocket gets deeper and deeper, it becomes harder for your tools at home, like floss, even water pick and a toothbrush, to reach into those areas and adequately remove the bacteria that have settled there. And when this happens repeatedly, settling of bacteria, it creates an inflammatory process where the body is trying to fight this invasion of bacteria. And it does that with the release of some chemical mediators we call cytokines. Cytokines is a word you probably have heard around response to coronavirus. But cytokines are immune mediators that help fight infections in the body, but they also cause things like inflammation in these areas. And so as the gum tissue inflames in response to this bacteria, the gums get plump, they get sore, they can bleed, and it also can further increase the pocketing. When we have exposure to chronic amounts of plaque and bacteria underneath the gums in these pockets, the jaw bone, in an effort to stay away from infection, will actually fall further. And this breakdown of the bone around the tooth is what we call periodontal disease. Periodontal disease is the destruction or loss of bone around teeth. And as you would imagine, as the bone retreats, the pocket gets deeper, and the process is kind of self-reinforcing. So when pocket levels get beyond, say, 5 millimeters, we generally say that we have some active periodontal disease, and we can tell this through measurements with those probes and also assessments of things like bleeding in the gum tissue to determine if you have active disease. When we have bacteria and plaque attached to root surfaces of teeth underneath the gums, we need a procedure called scaling and root planing to adequately remove those areas. By legal definition, a pro-fee or a recall appointment, which is what we call your normal cleanings, do not allow for cleaning underneath the gum tissue. When we clean under the tissue, that procedure, coded through our dental coding and through insurances and things, is called a scaling or a root planing procedure. And that's a little bit different than a regular cleaning. Generally, scaling and root planing is a 2-appointment procedure. We tend to split the mouth into a right and a left side. And most of the time, scaling and root planing involves using small amounts of anesthetic to numb the gum tissue so that your dental hygienist or your dentist can get deep down underneath those pockets without creating sensitivity for you to adequately flush and release all that plaque and bacteria that's attached to it. Now, most of the time when we need something like scaling and root planing, we can see evidence of the bone destruction in our x-rays, and sometimes we can even see evidence of the calcified plaque or the calculus underneath the gum tissue as well. So if your dental team starts describing this procedure to you and says that you need it, don't be afraid to ask questions. Ask, what were my probing depths? If they say 2s and 3s, you're generally not indicated for scaling and root planing, but numbers like 4, 5s, and 6s require this deep cleaning procedure. They might even be able to show you evidence of the attached plaque underneath the gum tissue on your x-rays, or you might be able to visualize the loss of bone around teeth. Untreated periodontal disease can be a huge problem for people. A lot of times patients say, this doesn't hurt, it doesn't bother me, why do I need this cleaning that maybe costs a little more than a regular cleaning? It requires me to get numb, and it takes 2 or 3 tries. Why do I need this if it's not a problem for me in terms of pain or discomfort? Periodontal disease, or this loss of bone, is the reason that we lose teeth. Teeth can break and obviously get cavities and things like that, but most tooth loss in the adult population in the United States is actually related to periodontal disease. And as you can imagine, just like if you went outside and started digging a big hole around an old tree, eventually you would dig enough that the tree would start to get wobbly, and we see loosening of teeth as a result of this process, and eventually the tree may fall over and you can lose a tooth. The good news is that when we have pocket depths of 4, 5, 6 millimeters, these are highly treatable circumstances. When we get to it early, we can adequately reach this bacteria, flush it properly, and create a path for some healing. Now, if the pockets continue to deepen and they get severe enough, even our scaling and root planing procedure may not be able to adequately clean. And that's when we get into the need for things like laser therapy at the periodontist's office, surgical scaling and root planing, which involves flapping or opening the gum tissue to expose some of these areas that are so deep it's hard to reach. And sometimes we actually need to add in new bone or new gum tissue in order to repair things that are lost. So the goal in a scaling and root planing, particularly if you fall into this mild to moderate category, is to prevent the need for those more advanced therapies and kind of set you up for success.